Okay, thanks. So yeah, remind me again if I forget, but I believe I can make that setting so that way I don't forget. It's better to record and me stop it than not record. But remember, I did talk about all this in the recorded lecture too. Okay, so it's not all lost. All right, let me go back and share my screen again. There's just a couple more things. All right, you guys see my screen again? So then this is just another example. I'm not going to go through this whole thing again. I think you guys can kind of look at this. Is another example with asthma attack, right? So what are some of these broader concepts that are related then to asthma attack? So this is really kind of these two flow charts are pulling some information from that table that I mentioned, right? It's essentially, that's what it's doing, is sort of putting it together. All right. Does anyone have any questions about this?
Yeah, I had a question.
Mm-hmm.
I wanted to know how immunity influences inflammation. Like, I have a theory in my head, but I don't know, so I just wanted to ask that.
Well, when you think about inflammation, I mean, it's an immune-related process, right? So that's how, right? Because that's part of the immune system is what's going to be triggered, right? And mount that immune response. Okay, so sort of inflammation or these inflammatory molecules and cells are part of the immune system. They're immune system molecules. Does that make sense?
Yeah.
So you may have I mean, and you can see how genetics can kind of feed into this. I mean, you can have this genetics arrow going to immunity too, where you just have, for some reason, this genetic predisposition to have more of inflammatory molecules around or what have you, right? Or yeah, for some reason that immune system is just behaving a little bit different. And so when you're then presented with an environmental allergen, that response that's mounted is a lot stronger maybe than somebody else's. Okay, so does that answer your question?
It does. Thank you.
Yeah.
Dr. How does obesity affect on it too?
Yeah. So again, for whatever reason, obesity, and it's just really because of the stress that it puts on the body, then again, triggers immune response, right? And so it's almost like, think about like that obesity as being this sort of stressor that's there all the time. And then that's affecting the immune system. And so just in general, you have a general increase in inflammation in your body if you're obese, right? So we said genetics can cause that, but even lifestyle can cause this sort of increase from like sort of baseline inflammation, right? So inflammation is good sometimes, right? You think about an injury, you're going to have inflammatory molecules that go to that site to basically identify it as that's where the injury is, right? And then a whole bunch of other molecules and cells will follow it to try to sort of repair or heal. But if you're in this sort of perpetual state of inflammation, those inflammatory molecules start to become damaging, right? And they can damage cells and things like that. And so, so I don't know if we know exactly why obesity, kind of what exactly is the mechanism as to why you have this increase in inflammation, but it does, right? Does that help? Abby?
Yeah, thank you.
Other questions, guys?
How about genetics?
Yeah, so same thing. I mean, this is just, again, basic, based on what your genetic makeup is, just like any disease, right? You have, if we talk about like genes that are linked to cancer, right? And there are many of them. If you have that sort of cancer version of the gene, you're going to be more likely to develop cancer, right? If you then end up hitting all the, or being exposed to other environmental factors as well. So it's the same thing here. For whatever reason, there's just certain variants of genes that lead to this overall increase in inflammation. Okay. And so again, if your baseline increase if you're sort of normally higher, a little bit of an exposure is sort of going to push you over the edge, right? If you kind of think about that, and then create this sort of massive immune response where then it could lead to something like an asthma attack. But it also can lead to many other things too, right? If you think about autoimmune diseases in general, right? There are many different ones. Again, influenced by genetics, influenced by obesity, right? Influenced by all these same things. Other questions, guys?
Not really a question, but more like a comment.
Mm-hmm.
So it's kind of like the body, right? So like with inflammation, that's caused by like an immune response, right? And I'm guessing the like having a lot of those T cells and stuff like in one place, right? So it's
Well,
kind
not
of like,
necessarily, yeah, not necessarily T cells though, but I
well,
mean, like cytokines, right? There's
yeah,
these small molecules and stuff like that that may be released from those cells. But yeah, any kind of anything. Could be anything really. Go ahead.
yeah. So it's like the body's trying to help itself by getting rid of toxins and whatnot, but then it actually ends up hurting us in the form of inflammation, and then we get all of these things.
Yeah, correct. I mean, you need those molecules, right? You need those cells to be around, but if there's too many of them, right, it sort of gets this creates this response that's excessive, right? And then it can lead to all sorts of different things. I mean, it just kind of depends on all these other factors that play into it, right? Because when you think about, again, you think about an autoimmune disease, that's this really strong increase in immune activity and inflammation. But it could lead to things, right? MS, multiple sclerosis is an autoimmune. What's another example of an autoimmune?
Lupus.
Right, yeah. Some other ones too. There's a bunch, right? And so it's kind of, if you think about it, right, it's the same thing. You have this increase in inflammation, this increase in immune activity, but then it manifests itself in very different ways, right? Depending on that individual, because there's genetic components, there's all these other different factors that that feed in. And so that, you mean, that's why it's complicated. It's always complicated, right? Disease is complicated. That's why we don't know the cause of most diseases, okay? Because there's so many things that are going to influence it. That's why you will never, not be needed in science or medicine, right? We don't know anything. We'll never know, right? We keep learning more and more every day because there's just so many things that can impact it. And so that's really what this chapter, I think, is kind of I want to get you to start thinking about that. And so when we talk about specific diseases, we got to think about big picture too, and what all these other things that can be, affecting it. Right? Other questions? Okay. So I don't know why won't my arrow work? So annoying. Oh, there we go. Okay. So this is really just some, again, these are the terminology, right? Health, illness, talks about like a continuum. I think you guys can kind of, everyone probably agrees kind of with this sort of idea, right? One other thing that I wanted to just kind of mention this. So I give this example, or the book gives this example of these kind of 3 different patients here, right? And one in panel A is an infant, right, who has Down syndrome, okay? So he has a disease, he's very, clear-cut genetic disease and what have you. In panel C is a more sort of acute kind of probably injury that he came in with, okay? But then in panel B, if you their example that they're giving here is, it's a woman that has, just to get her symptoms right, joint swelling, pain and fatigue, right? And so the pain and fatigue is really getting to affect her daily life. However, she's not diagnosed with anything right now, right? So that's the idea, is that, you can be ill without having a disease, right? And it also kind of wants you to think about also like acute versus chronic disease, and how these things how there's so much variety. Okay, so that's the point of kind of bringing this up. Again, it's about just giving some different examples. Does anyone have any questions about that? So I think the idea is that you can have a disease and not maybe really be ill at the moment, right? You can also be illness and not really necessarily have a disease, right? Or be diagnosed with a disease. So I think a lot of times we use the terms interchangeably, which is fine. But I guess if you really think about the difference, illness brings in the patient's perception, right? Whereas disease is just, this is the disease you were diagnosed with based on your symptoms, right? And your patient history and what have you. Questions, guys?
So illness is a subjective term?
Yeah, so illness is really a subjective term. But one of the nursing students was asking me about the difference between this. But honestly, a lot of times probably people do use them interchangeably, right? So it's not like the most clear-cut kind of difference, but it's really, when you think about illness, you really want to think of it being more subjective.
So what would be a word that you can use that'd be like objective that they have something? The disease
Yeah,
or no?
disease is more objective, correct.
Okay.
Yeah. All right, so again, these are just terminology. So make sure we know all this terminology here. One other thing I guess I can kind of think about this too, or just hit on this, modifiable risk factors versus non-modifiable risk factors, right? Ones that can't be changed, ones that can be changed. I think, again, I give a few examples here. You can come up with some more examples, right? What's another modifiable risk factor you guys can think of? Another modifiable one that you can change.
Sleep.
Yeah, good. That's good. That's a really good one. What's another one?
Exercise, I
Yep.
guess.
Yep, good.
Drinking.
Yeah, good. Yeah. I mean, so there's so many different modifiable risk factors that you can think of. I mean, even like stress levels could technically, that's modifiable, right? How do you deal with that stress? Or maybe you need to remove yourself from a stressful situation. Those are modifiable. Sometimes you can kind of think of it not being sort of non-modifiable, right? I think I asked this in the recorded lecture, but can somebody kind of think about an example or like a situation where like maybe diet isn't modifiable?
Like for religious or cultural purposes.
Okay, that's good. What else? What's another kind of example you might
for
be
like diabetes? Don't
But-
you have to eat like certain sugar amount?
Yeah, but I mean, in that case, I guess your diet would be tailored to make you more healthy, right? But correct. I mean, I guess if there was it was causing some other issue, then it would be hard to sort of modify that because you have another condition or something like that. Yeah. What else? What's something else you guys can think of? Think about like special populations, or like, and we kind of talked about that. I talked about that towards the end of the chapter, right? That you need to always sort of consider, like pediatrics and geriatrics and pregnant population differently. So what do you think about that?
I guess like for babies, because they have to like be fed with milk.
Yeah, and dependent on their parents, right? And so a child may not really be able to modify their diet. I mean, their parent might be able to, right? But there also are, what about like monetary reasons or what's available, right, to a certain community? So those are things that like you might think, or kind of think in your mind to your patient, well, why can't you change that? But maybe really there are other factors that make it really difficult for them to change, right? So anyway, these are all things that you think about, right? When you're thinking, again, about a patient with a disease, and you're going to have to, counsel them and tell them what they need to do to be healthy, or you have to consider so many different things, right? And so some of these risk factors are things that you would consider. All right. Okay. The other thing in this section is really about kind of how the book's going to be structured. So when we talk about disorders and conditions, we'll always talk about the etiology, the pathogenesis, and then the clinical manifestations, okay? And then try to link the pathophysiology of that disease to diagnosis and treatment, okay? So it's always going to sort of be structured in that same way in each chapter, all right? Or for each sort of disorder. And then again, here's some more terminology, right? What does etiology mean? It's the cause of the disease. So I think I kind of said this, but what do you guys think? Do you think we know the cause of most diseases? Would you make a statement like that? Who would say, yeah, we pretty much know the cause of most diseases that we have?
I would say no.
I agree. I would say no. The truth of the matter is no. We really don't for most, right? Most diseases are, I mean, I have it mentioned here as like multifactorial, right? And most of the times we don't know the disease. So what's the term for a disease with an undetermined cause? Idiopathic. You guys have probably heard that term before, right? So again, these are probably, if we took medical terminology, right, we go through some of these terms already as well. So really, you probably don't need to take medical terminology if you take pathophysiology, because you hit all the medical terms that we talk about in medical terminology. But anyway, but there are also diseases that can be caused by like a medical mistake, right? And we call those iatrogenic iatrogenic, right? So those are things to think about as well. And then I also have kind of, I tell you guys to think about some different examples, right, of exogenous agents that can cause disease, right? So I kind of have them broken down into 3 different categories. So chemical, what's an example of a chemical agent that might cause disease?
Pollution.
Pollution. Okay, what else?
Carbon dioxide.
Yep, carbon monoxide, right? What
The
else?
type of, like the fertilizers that they spray over like fields and stuff
Yeah.
like that.
Yeah, good, potentially, right? Yep. Things like lead, mercury, right? Those types of exposures can cause issues, especially in younger population. What about physical? What do we mean by a physical exogenous agent? Like electricity, something like that, right? Some kind of, something that causes an injury. And then
Fire.
yeah, fire, good, yep. And then obviously infectious agents, we're all too familiar with those kinds of agents, right? Bacteria, viruses, what have you. So, and then again, important to think about endogenous. And we kind of were talking about this as we were looking at those flow charts, right? Things like genetics, right? Gene mutations, abnormal immune reactions. Those are all endogenous agents that then can cause disease, right? All right. And probably that's again, just terminology. If we talk about a sign versus a symptom, right? What's the difference? How would you describe that difference? I mean, it kind of says you right there, right? But when we say subjective, we mean usually we're talking about the patient, right? So the patient feels these things. The patient feels pain. The patient is going to have to tell you that they feel short of breath, right? Which is different than signs where you can observe them, right? Those are objective to the clinician, essentially. Okay. So signs, symptoms. And again, those are probably 2 terms that sometimes people use interchangeably as well, right? But really symptom is subjective to the patient. Again, I think I kind of mentioned some of these things. So these are just some broader terms that we want to think about: acute versus chronic, right? Exasperation versus remission. Okay. All right. Okay. Let me come just back to here in a second. So again, I mentioned this. I'll come back to the genetic stuff because that's the next chapter, just to kind of introduce that next chapter. But in terms of, lifespan considerations, it's important to know your population, right? And to know that there are certain diseases that a child is more inclined to get, and there are certain diseases that you only see in the geriatric population, and certain ones that you really only see with pregnant women, right? So that's the idea, is again you have to think about these things if you're trying to diagnose a patient, right, and really understand what's going on. You got to always consider that as well, lifespan or sort of age of the patient, or what situation they're in. Okay, so that's one thing that, again, in every chapter we sort of always bring this back and talk about lifespan considerations. So again, that's why we're introducing it here, because it's something you're going to see throughout. Okay. Okay, the last part of this. So one thing, again, this is more terminology: morbidity versus mortality, the idea of, or the field of epidemiology, right? Again, probably something we've heard a lot about lately, right? Why is it so important that there are epidemiologists around, right? I gave an example, and I think it's worth, I'm not going to go through the whole example, but I mentioned an example. Do I have it on here? No, I mentioned an example that has to do with that, and it's in your book. So listen to the recorded lecture, because I don't want to spend more time on this, because I want to make sure I get to the last couple of things I want to cover. But there's an example on page 14 in your book about type 2 diabetes in youth. And I think it really, it's a good example for understanding why epidemiological studies are so important. Okay. So it's about like type 1 diabetes versus type 2 diabetes in children. Okay. And so again, listen to the recorded lecture, read that in the book, because I think it's a nice, really nice illustration of that. All right. So anyway, when you talk about epidemiology, we talk about, and you guys have heard terms like this before too, right? Incidence of a disease. So that's the number of new cases, versus prevalence is just the number of cases that exist at that time. Okay. So slightly different terms. Obviously, important to think about public health. Again, something that probably we think about a lot these days, maybe more than normal. Okay. Mortality versus morbidity. Okay. Two kind of, again, slightly different terms. So this is basically showing you leading causes of death. I think, I forget. Oh yeah. So this is from 2015. In terms of number of deaths or mortality caused by specific disease. Okay. So you got heart disease up there, but cancer is pretty close to it, unfortunately, right? All right, so the last part of this talks about evidence-based practice, okay? And so again, we've done a decent amount of reading, research articles and things like that. I guess the one thing I just want to bring up with you guys here is that whether you're a clinician, whether you're a scientist, right, whatever, it's still important to keep up on that literature, right? And it will affect how you practice, okay? And I think I kind of mentioned this too in the recording, that maybe it's not really totally the individual's responsibility, but you know, if you're wherever you're working, whatever department you're working on, whoever's the chief of staff, you know, maybe they hold meetings or journal clubs where you talk about kind of new research and say, hey, can we implement that here, right? So it's super important. You can't just, you know, continue to do the same procedure for 25 years and never really know about something that's new. I mean, this is totally true in science and in research, but also in, you know, in the clinical field as well. So the way we're going to bring this in is really by reading some journal articles from the outside, like I said, okay? So that segues into the article. So what we're going to do is I'm going to show you where it is, and then I will go back to the genetics, like I said. I'll leave you guys with a couple things to do before our class on Monday, okay? So let me go back. So the article that I pulled, and again, I kind of pulled it quickly. I just want you guys to kind of read through it and don't go crazy. So let's just read through it and just be prepared to talk about it on Monday. And then from there, I may give you a more specific assignment with it, or I may just give you another article related to COVID that will do a specific assignment to, okay? So for now, all I want you to do is read through it, be familiar with it. I'll probably just pull out a couple things that, you know, stood out to me, and we'll talk a little bit about it, okay? But it's a review article, so I think it'll give us a little bit of an overview. As I said, it was published in, I'll double check that. Where did I see where the I believe it was published in March. And again, it's written by, you know, a Chinese group, okay? And so that's what they're sort of reviewing. But, you know, they talk about the epidemiology, right? So it's all broken down. Clinical manifestations, okay? So I think it's super important because this really brings up kind of all the different things that we're going to talk about when we talk about different diseases. This sort of gives you a nice overview related to COVID. Okay, so that's one thing, and I'll probably send you guys out a little announcement or email just to remind you what you need to do before Monday. But let's read this, maybe take a few notes, and just be prepared to talk a little bit about it at the beginning of class on Monday. All right, any questions about that, guys? It's not very long. It's actually super short. You're welcome. So let's do that. Any questions about that, guys? All right. The other thing that I want you to do, well, I will put up chapters 2 and 3 for next week. I mean, chapter 2 will at least be up. Chapter 3 might not be up until like Wednesday or something like next week, okay? But chapter 2 will be up. What's today? Yeah, I might get it up today. I'll get it up. I'm going to try my best to get it up today. Okay. If not, it'll be up over the weekend by Monday. And then chapter 3 will be up shortly after that. Now, remember, the PowerPoints are already there. Okay. So you can kind of start reviewing there. So that's sort of a side note. So for Monday, it's reading the article. Then I also want you guys to go to that review sheet. Like I said in the beginning of class, we were going to kind of do this together, and I may just try to break us up into groups just to see how that works. I just want to try out the breakout rooms. But I'm not going to have you guys work on that right now. So we'll probably do that with chapter 2 though. So for chapter 1, I want you to add in all that terminology that I kind of mentioned that I mentioned in the recorded lecture, and that are, in bold in your textbook, and define it. Okay. And you can add in any other notes that you might want to add in there that you think are going to help you study for the exam. Right? Does that make sense to everyone? You're not going to have to submit that yet, but remember, we will be submitting that before the exam. So we're going to complete chapter 1 now. I may ask you to show me what you got. So be prepared. Be prepared to maybe share your screen or something like that with your chapter 1 terminology in there. Okay? For Monday?
We all individually have to submit our own review sheets.
Correct. Unless
Is
somebody
there
else
submission?
for you. Yeah. So like I said, I'm going to have you just do one submission of it though. I'm not going to have you submit chapter 1, then submit chapter 2, and then submit chapter 3. But for chapter 1 needs to be done by Monday. I may ask you to share your screen and kind of show us what you got or talk about it. Okay. So yes, it should be done individually because it's going to help you study. Now, with that said, all right, so let's back up a little bit. If you want to work with somebody on it, I'm okay with that. What it can't be is you copying from somebody else. So I may take that back if I see that there's copying going on, but if you want to work with somebody and then your review sheet looks similar, I'm okay with that. Okay, I'm okay with that because again, this is meant to be like a study tool. So however you sort of want to use it. But again, be prepared on Monday to share your screen with what you wrote in for chapter 1, okay? And again, go ahead.
Sorry, Professor, about the terminologies in chapter 1. How about if I print it out and write maybe by pencil and
you can do that.
Like
but then you're gonna have to you want to still have access to that electronically. So you'll either have to take a picture of it or scan it or something like that to be able to share it, and then also to be able to submit it down the line. But if you like to handwrite, that's okay. Yeah.
Okay, thank you.
Okay. Yeah. So like I said, for this, you could just really for chapter 1, just list. You can just list and define. Okay, if you want. That's fine.
Okay.
Okay.
Yeah.
Questions about that, guys? Yeah. Okay. All right. So that was one thing. The journal article. Be prepared to, like I said, share that, and then eventually I will have you guys submit it as an assignment, just so that I can then grade it or just have it as mark it as you did it. And then there was one other thing. Oh, what was I gonna do? Let me just pull up chapter 2 real quick. So chapter 2, again, is still like a little bit of, I guess this first unit is kind of is introducing things that are going to impact all diseases. So think about it that way, okay? So for instance, and actually, if you look, right, so chapter 1 is basics of pathophysiology. Chapter 2 is genetics, okay? Chapter 3 is environment. And then chapter 4 is stress. So these are all factors that will influence all disease. And so that's why it's kind of that's what that first unit is focused on. Then we'll get more specific, all right? So like I said, for chapter 2, again, this chapter will probably be a little easier for you guys than it was for the nursing majors. When I remember from last year, I had a lot of questions, about just like basic genetics in terms of like this kind of stuff, right? Like what makes up DNA and that kind of basic stuff that you guys, I hope, should be pretty familiar with. So some of this is really just basic science in the beginning, okay? Things that you guys already know. So I'm going to skip through that quickly. I'm not going to probably review this much, but I know when I taught this last year, I had to spend a lot of time in class on this because they had a lot of questions. and it's fine if you guys have questions and want refresher, but I expect that you guys are probably good with this, what's in the beginning here, okay? So it's really just, again, basic genetics. So, and then it talks about epigenetics. And I'll, you know, obviously I'll put up a recording about this, but the book's definition of epigenetics is kind of a little weird, and I don't know if I sort of agree with it completely. I kind of see kind of where it's coming from, but I think, again, you guys know about epigenetics, and so when you see sort of the way they describe it, you might be like, but then, so it's just sort of a different way of describing it, I guess. Different than I would, but it's not wrong, put it that way. So anyway, that's that. Really, it's all just really basic genetics and really understanding how a mutation, right, could lead to disease, essentially. And you guys probably, most of you guys probably already kind of understand that concept. But like I said, it was really hard to sort of convey that with the nursing major. So all of this might be review. All right. So anyway, just wanted to kind of let you know what was next. So I'll put that up sooner rather than later. All right, so last thing, this is what we're gonna do. So we'll see who's awake, okay? And there. I'm going to stop my share, and I'm gonna break you guys up just randomly into breakout rooms, okay? Because I wanna just see how this works. We have like literally 5 minutes. I just wanna see how it works, and then we'll probably use it down the line. So did you guys ever do this before in Zoom? No?
I have.
Okay, yeah, so it usually works out pretty well. I've done it. Like I've been a part of it, but never really actually done it. So anyway, I'm just going to do it randomly. I guess how many, I'll probably put 4 of you in a room here. So hold tight. Let's see what happens. Oh, break 20. Okay. That should work. All right. It's going. All right. So now I'm opening the rooms. It should automatically, oh, does it ask you to, okay. Put together. Did I put you guys in a room? Yep, it's going. Yep. Sorry, I'm muted. I don't know why it automatically mutes. Anyway, we'll probably use them to do some things next week. We are finished. So unless if you don't have any other questions or anything like that, bye. I'll see you on Monday. If you have any questions, I'll stay on for a little while. You guys are just coming back.
Bye, Dr.
Feel
Ed.
free to leave.
Bye, Dr. C.
Bye, guys. Bye, Dr. Kaminsky. Bye, guys.
Oh, I have to take the quiz because I missed it yesterday since I had a final. Yeah.
Let me, so just stay on for a second. Just so I can just tell you about it real quick.
Dr. Kaminsky, did you get my email? I'm not sure if it went through though. I
What?
did it.
Is?
Yeah, like I sent.
It
It
says you
did.
did it. Yeah, it says you did it.
Okay, then. All right. Bye. Have a good day.
You too.
Bye.
Yep. So I'll see everyone Monday. If you have questions, stay on. Anyone else have questions? Rachel? Oh, let me stop recording.